Informed consent. 1. The cause of action is informed consent. 2. Plaintiff would argue defendant breached their duty of informed consent. 3. A doctor has a duty to inform a patient of all material risks incident to treatment. 4. In a reasonable patient jurisdiction, the standard for informed consent is what a reasonably prudent patient would want to know. 5. In a reasonable physician jurisdiction, the standard for informed consent is what a reasonably prudent physician would tell a patient. 6. In a subjective patient jurisdiction, the standard for informed consent is what that specific patient would want to know. 7. Plaintiff must prove defendant 8. Failed to adequately inform patient of a material risk before securing consent to proposed treatment. 9. If informed, the patient would not have consented because of informed risk. 10. 3. The adverse consequences not made known manifested an injured patient as a result. 11. Defendant would assert an affirmative defense arguing an exception to their duty of informed consent because the risk was known by a patient or should have been known by everyone. 12. Here, defendant would argue it was reasonable for patient to have known of the risk because blank. 13. Defendant would assert an affirmative defense arguing an exception to their duty of informed consent because of a therapeutic exception. 14. A therapeutic exception allows a doctor to withhold disclosure of material risk because it is detrimental to patient's best interest. 15. Here, defendant would argue disclosure of the material risk was detrimental to patient's best interest because blank. 16. Defendant would assert an affirmative defense arguing an exception to their duty of informed consent because of emergency circumstances. 17. In an emergency circumstance requiring prompt treatment, patient cannot grant consent or be informed of any material risk. 18. Here, defendant would argue blank was an emergency circumstance and patient could not grant consent or be informed of any material risk.